According to the Center for Disease Control and Prevention, 40% of American adults have reported struggling with their mental health and substance use in late June of 2020, the time that COVID-19 cases were gradually rising. This indicates that there is an increase in stress, anxiety, depression, and even thoughts of suicide. Are these same numbers present here in Laredo? What about students in college? Is there a way to improve their mental health? That's where research comes into place. Hello, my name is Raquel Puig, and my research topic is on the mental health of college students during the COVID-19 pandemic. As we already know, coronavirus disease 2019, or COVID-19, is a novel coronavirus that was discovered in Wuhan, China in November of 2019. Once the virus slowly became more susceptible towards the public, the World Health Organization began to implement safety protocols to prevent further cases. These protocols included wearing a face mask when going out in public, constantly washing your hands, and staying at home as much as possible. By March of 2020, the world had completely shut down. When acknowledging mental health, stress is a feeling of emotional or physical tension. Another mental health challenge is anxiety, which is a feeling of worry, nervousness, or uneasy, typically about something with an uncertain outcome. Lastly, depression is a mental health disorder characterized by a persistent depressed mood or loss of interest in activities, causing a significant impairment in daily life. With this information in mind, it is important that we evaluate our public's mental health, especially among the youth of Laredo. The purpose of this study is to analyze the mental health challenges, which are stress, anxiety, and depression among college students in Laredo, Texas, due to the COVID-19 pandemic. As previously stated, participants of this study includes students between 18 to 23 years old and are enrolled in a college and/or university in Laredo, Texas. To conduct my research, I created surveys that questioned the students' mental health status with the browser SurveyMonkey. I also used a statistical package for social sciences software to collect my data and create a statistical analysis chart of the students' responses. To ensure their confidentiality, participants did not include any personal information in the surveys, such as their name, phone number, email, etc. Considering that the COVID-19 regulations were in place, participants completed the surveys online, preventing any person-to-person contact. After a week of data collection, there were a total of 28 participants in this study. The recorded majority of participants were females between 18 to 19 years old and were in either their freshman or sophomore year in college. Participants were questioned on their experience with COVID-19 both physically and mentally, and the general experience was rated moderate with an average score of 56.33%. Moving on to questioning the mental health of the participants, students' stress levels were moderate with an average of 37.14%. Next, participants' anxiety levels were concluded to be moderately severe with an average of 32%. Finally, students' depression levels were concluded to be severe with an average of 40%. The data collection of college students' survey responses was concluded that the mental health of the college students in Laredo, Texas has worsened since the beginning of the COVID-19 pandemic. Considering the results of the collected data, the community should now take into consideration of the mental health of college students. However, with the COVID-19 vaccine becoming available to cities across Texas, colleges and universities may begin to slowly open campuses and provide face-to-face learning to their students. This may lead to a gradual increase in students' mental health, and further research should be conducted with said information in mind. Some limitations in this study include distribution of surveys completely online, small amount of time of data collection, low number of participants, and incomplete surveys from the participants. This study has analyzed and concluded the mental health of college students in Laredo, Texas, and the next step would be to remind these students that there is still hope for the future of our community. We must acknowledge that no one is alone in this pandemic, and that there is always someone who is willing to help. Together, we can learn to grow stronger and stay patient until the COVID-19 pandemic comes to an end. I would like to thank the LEAPS program for granting me this opportunity to research a topic I found very beneficial to our community. I would like to thank Dr. Garza, Ms. Agüero Riojas, and Ms. Solis Cavazos for allowing me to participate in this program. I would also like to thank my faculty mentor, Dr. Laura Lopez, and my student mentor, Jaime Cotino, for assisting me throughout the entirety of my research project, along with helping me perfect it in the best way possible. If you would like to see where I based my research off of, you can examine these sources to look at different data and conclusions different researchers came to in their research. Thank you.